Hello. In this video, I'm going to talk about the 5 things that diabetes patients should avoid. Diabetes is one of the chronic diseases that many people face, and proper management is crucial. So in this video, I will specifically discuss the items that should be avoided. Are you ready? Let's get started. First, avoid sugary drinks. If I were to mention one food that diabetes patients should definitely avoid, it would be sugary beverages. Carbonated drinks, fruit juices, canned coffee, instant coffee, vitamin drinks, and other sugary beverages have the highest absorption of sugar, which quickly raises blood sugar levels more than any other food. Then, the consumed sugars accumulate in the bloodstream. Additionally, these beverages provide no nutritional value and only serve to raise blood sugar instead of being utilized as energy. They have no other function in the body except increasing blood sugar. Diabetes patients who consume sugary beverages twice or more per day have a 2.4 times higher risk of tooth loss compared to those who do not consume them. The link between sugary beverages and tooth loss exists not only in people without diabetes but is more evident in diabetes patients. Therefore, diabetes patients are more sensitive to added sugars in beverages compared to the general population. Diabetes patients who consume sugary beverages more than once a week have more than a 5 times higher risk of abdominal obesity compared to those who do not consume them. Sugary beverages not only contribute to belly fat, but they also increase the risk of various complications associated with diabetes, such as cardiovascular diseases, brain-related issues, and metabolic disorders. Remember, there is no better drink than water. Wait a moment. If you subscribe, like, and enable notifications, you can receive diet and health information quickly. Second, avoid dried fruits. Many diabetes patients feel frustrated because they cannot freely indulge in fruits. As a result, many people consume popular dried fruits and nutritious snacks available in the market. Dried fruits can be healthy for individuals with normal blood sugar levels. When fruits are dried, the dehydration process concentrates the nutrients and fiber, allowing for a higher intake. Dried apples, for example, can have up to 10 times more calcium and 12 times more vitamin B2 than fresh apples. However, for diabetes patients, dried fruits are the worst food because they also increase the carbohydrate content, including starch, which can quickly raise blood sugar levels like a bomb. For example, while a cup of grapes contains about 27 grams of carbohydrates, a cup of dried grapes or raisins contains around 115 grams of carbohydrates, which is more than 4 times the amount. Consuming such concentrated sugars may provide a temporary boost of energy and mood improvement, but it can lead to pancreatic strain from sudden sugar influx and damage to our blood vessel walls. Dried fruits should be avoided by diabetes patients. If you desire dried fruits, it is much better to opt for fresh fruits. Choose a moderate portion size based on fresh fruits and consume it slowly. Remember that dried fruits are not a healthy option for diabetes patients. Third, avoid trans fats. In simple terms, you can think of it as fried food, fast food available in the market, and bakery products. It includes fried chicken, pork cutlets, hamburgers, pizza, cakes, packaged snacks, and bakery bread. Many people suffering from diabetes focus only on their blood sugar levels, but in reality, another important factor is neutral fats. Diabetes patients tend to have increased levels of neutral fats and blood sugar levels. The reason for this is insulin resistance. Even when insulin is secreted, it does not perform its role properly, causing fatty acids that should have been absorbed by insulin to flow into the liver, leading to an accumulation of neutral fats. The dangerous aspect of neutral fats for diabetes patients is that it significantly increases the risk of diabetes complications. The continuous accumulation of neutral fats raises the risk of cardiovascular diseases and increases the likelihood of diabetes complications. When purchasing food, always check the nutrition label on the back and make sure the trans fat content is 0 grams. It is recommended to consume healthy unsaturated fats such as fish, nuts, and olive oil in sufficient quantities. Fourth, stress. When our body experiences stress, our blood sugar levels rise rapidly, just like our blood pressure. Blood sugar and blood pressure tend to increase together when we are under stress. When we experience significant stress, stress hormones are secreted in our bodies. One of these stress hormones is called cortisol. When cortisol is released, it has two main effects. It rapidly increases blood sugar and also raises blood pressure. Therefore, when we are stressed, both blood sugar and blood pressure rise simultaneously. However, it is not easy to avoid environmental and social stresses, is it? That's why, if you've experienced tremendous stress, it's essential to release that stress. The method to relieve stress is by practicing deep breathing, specifically a technique called diaphragmatic breathing. Diaphragmatic breathing, also known as deep belly breathing or abdominal breathing, is a breathing technique that involves using the diaphragm, a large muscle located between the chest and abdomen. Instead of shallow chest breathing, diaphragmatic breathing focuses on expanding the abdomen as you inhale deeply and contracting it as you exhale fully. This technique allows for more efficient oxygen intake and can help induce relaxation, reduce stress, and promote a sense of calm. This can help detoxify the stress in our bodies. Additionally, moving your arms and legs is also important. In order to consume the sudden rise in blood sugar caused by stress, you need to engage in muscle movement. If the pancreas alone tries to handle it, it will eventually become overwhelmed, leading to diabetes. By coordinating the movement of the pancreas and muscles and helping to consume blood sugar, we can prevent the onset of diabetes caused by stress. Furthermore, it is natural for diabetes patients to have their condition worsen due to stress. Therefore, diabetes patients should be mindful of managing their stress. Fifth, avoid sleep deprivation. The time when our body naturally heals damaged cells is during sleep. Insufficient healing time naturally leads to decreased pancreatic function. When we lack sleep, our blood sugar levels do not decrease sufficiently, so it is natural for patients to experience elevated blood sugar levels the next morning. Blood sugar levels decrease when we start sleeping, reaching their lowest point when we are in deep sleep. This time is usually around 4 a.m. Therefore, to ensure that blood sugar levels reach their lowest point and prevent elevated blood sugar levels the next morning, it is crucial to achieve deep sleep and maintain an adequate amount of sleep. Scientists generally recommend around 7 hours of sleep as an appropriate sleep duration. The important thing is to consistently prioritize the sleep duration in which you wake up feeling refreshed the next morning, as it is vital for diabetes management. Today, I shared with you 5 things that diabetes patients should definitely avoid. Even by following these 5 things alone, it will greatly assist you in managing your blood sugar. If you maintain steady patience and carry out the actions, there will definitely be good results. That concludes today's video. I will return next time with even better content. Thank you for watching.